Hello, my name is Sarah, and today in the LLP series we're going to be covering the logbook. So in this session we'll be covering adding cases to your logbook, just some general advice on how to keep it organised and how to produce logbook summaries which will be needed for your supervisors to sign you off. So when you open up the LLP, it obviously brings you to this page here. Everything related to the logbook is handily in one little Dropbox domain here. So just quickly, in terms of what the aim of the logbook is for, it's there for a personal record for yourself, to keep track of any cases that you've been involved in. It's needed for ARCP sign-offs, and it is also needed for individual domain sign-offs, so things like peds, obstetrics. The relevant supervisors will want to see a logbook to see how many cases you've been involved in that is relevant to that specialty. It's also really useful as a personal record to look back on, as a specific record of cases or management of things that you might not see quite so often. If you were to do a solo list in future, you could look back and see how you managed a patient with a similar condition previously. There are obviously lots of options under this domain here. The one you'll use most often is the anaesthetic one. Obviously, we are anaesthetists, and this is the one that we'll cover in the most detail. Intensive care medicine, you can use this as a way to record all of the patients that you see when you're on your ICU placement. The only thing about using this is it wants you to record it per patient, which in practice, when you're on ICU, can be quite long and tedious at the end of the day, because you might be covering quite a big unit where you have involvement in lots of patients that day and be seeing lots of patients out and about the hospital for ICU reviews. So in practice, personally, I tend to use the session section to record things like my ICU days. Alternatively, I know some people that keep an entirely separate logbook, which you can then link back to your LLP for intensive care placements. Acute pain is as it's in the name. So I think that's for cases that you have had to do with the acute pain team. So acute pain ward rounds, and chronic pain would be things like chronic pain clinics or procedure clinics that you've done to do with chronic pain. Procedures standalone are procedures that you've done that might not necessarily fit within any of the other tabs. So more often than not, I would actually, any procedures that I'm doing, that might be like a central line in recovery, or I mean, in theory, you could do all your cannula calls that you go out onto the ward, although in practice, I have to say I don't record those. But it might be something, or a bronchoscopy that you've done down in ED, as part of an ED patient workup, you could use this tab to record. In practice, I tend to put that under anaesthetic because you can kind of get around that, but you could use the procedure standalone if you wanted to. And then session is for recording groups of patients or multiple patients. That is just an easier way of doing all of the patients at once. So I tend to use this for things like my intensive care days. I also use it for things like preoperative assessments when I'm on call, to keep a record of all the patients that I've gone to see before they come down to emergency theatres. Or I use it for EPOC, which is our post-operative care unit, kind of semi-HDU setting within theatres. If I'm on call and I've done a ward round of those on a night shift, I would do a session to cover EPOC reviews. But I'll cover all of these in a bit more detail in a minute. And then obviously this button at the bottom is to help you see your logbook. We'll start by adding some cases to the logbook to begin with, and then we'll look over how to actually look at the logbook and generate cases. So to add a case, under the logbook tab, click the relevant tab. So we'll go for anaesthetic today. You get brought to this page. So at the top, we'll tell you what case this is in the total of your logbook. It will auto-generate with today's date, but you can obviously change this quite easily. And then it's quite self-explanatory, the logbook adding cases. So you click what time of day is relevant. So we'll say that today we did this. Normally, it auto-populates with the hospital that your current placement is set to, and your deanery. So Another video will have covered how to set placements in their LLP overview. So this would auto-populate with whatever current placement you're on. However, if it doesn't, or if you're on a locum shift and it's a different hospital that you're working at to your normal environment, you just click change hospital and you pick the hospital that you're working at the moment. So then you come into the patient details. Now the first box, which is personal reference, is completely optional. But this becomes key when you're looking at filtering your logbook later on to generate a logbook report. And I find it's actually much more beneficial to put something in this box. So personally, I say which hospital I'm at. So we said we're at Aberdeen. I say whether or not I was doing a day or a night shift. And then I just talk about what specialty I've done. So we'll say this is a general case on a day shift. This then means, as a quick reference, when we look at the logbook, you can see what specialty that case relates to when you're looking at your logbook. So it can just help you find cases a little bit easier. But it also means when you go to generate the report, you can search general, and this will be picked up into that pool of patients. So then you talk about patient ages. We'll say that we've done a young chap for an appendix, whether or not it's a day case, their ASA grade, what the priority code was. So he was a U24, and you obviously talk about the specialty. So we'll say general. Now, most specialties are covered in here as we flick through, but obviously if they aren't, you can always use other. Things that I will talk about specifically, so paediatric patients obviously would have paediatrics as their specialty, but they would also have a secondary specialty. So a peds appendix would obviously be general and peds. In terms of the filtering capacity of the logbook, it tends to work better if you've got a paediatric patient to have that as the primary specialty. And then as their secondary specialty, you can then say that they were general. So we'll go at the top and we'll just rename this as peds general. And we'll just change that age to reflect that. So you click your primary specialty, you can say what operation, you can say there's a secondary specialty and general. So then we come on to the supervision levels. Now, supervision levels, your logbook is meant to be supervision levels of the supervision you think you were during that case. So immediate is quite self-explanatory. A consultant or a senior trainee was with you throughout the entire procedure. Local means that they were there nearby within the building if you need them at any point during the procedure. Now, they may have popped in, stuck their head in and checked that you're okay. I personally think that's okay to still call that local supervision if they weren't involved or helping or doing anything. Distant supervision means that they were either quite far away, so they might have been in main theatres and you're over in a separate building, or at home. And solo means that you were completely doing the list by yourself. In practice, this doesn't really happen when we're trainees solo, because even if you're assigned a solo list, you actually technically have someone that is looking over you. But these refer really to immediate being supervision level 1, local being supervision level 2, distant being supervision level 3, and solo being supervision level 4. And that relates to the codes that your SLEs are graded at. So we'll say they were local for this. They ask you who your supervisor is, and then ask if you've produced any provided any teaching to anybody today. Then you click your mode of anaesthesia. So we've got general anaesthetic with mask. We've also got LMA with spontaneous ventilation, LMA with ventilating, ETT with spontaneous ventilation, ETT with ventilating, ETT with an RSI, some local anaesthetic, some regional anaesthesia. So I think this is essentially local anaesthesia that normally the surgeons give, like local infiltrate, which in practice we're not really involved in. And the local anaesthetic that we would give would obviously normally be regional, and that includes neuroaxial as well as peripheral. Sedation, which often we're involved in just down in ED, or monitoring only. Now, you might use the monitoring only if you've gone down to ED for a trauma call and we've then been sent away. That is a patient that you have initially been involved in, but given that we've not done anything else for them, you would just click monitoring only. So we'll say for this patient that we did an RSI. Regional, self-explanatory if you've done any regional techniques. In this patient we didn't, but we'll say yes so I can show it to you. It's quite self-explanatory. It asks you what regional you've done. So it's got all the different types of blocks on here, including your epidurals and your spinals. If it's not covered, there is optional at the bottom. How you performed this, whether or not it was landmark, ultrasound or nerve stimulated, whether or not you popped a catheter in, and the supervision when you performed the procedure. In terms of filling in specific notes, and this is relevant for every section within this, it is complete personal preference. So generally, if it's the first time that I've performed the procedure, so if it's a type of block that I've never done before, I might fill this in just to give a bit of information, just so that I can then use it as a reference note in future, especially if it's a block that I don't think I'm going to be doing relatively often. But say it was a spinal and it's something I do all the time, I probably wouldn't put anything in here. So it's your logbook. So the more information you put on it, obviously the better reference is going to be for you in the future. But equally, there are some days that we do a lot of cases and it can get quite tiresome and time consuming to fill in lots of information. So that is complete personal preference. So we'll just go back and say no to this. Same thing for procedures. And it's the exact same boxes that it asks for you. This has got procedures. It's pretty much got everything. The only thing it doesn't have is LMA insertion, which often you'll do quite often for a general anaesthetic, but that isn't on here. But it has got double lumen tubes. It's got ETT tubes, it's got fibre optics, got gas inductions for children, jet ventilation and other fancy bits and pieces, as well as nasal intubation. It has also got peripheral venous cannulation if you've gone to do any cannulas on the ward, or if you want to document every cannula you've done for each patient you've given an anaesthetic to. It's got RSIs and it's got TEVA. This is also where you can record any transfers that you've done either between hospitals or within hospitals. And there is actually a separate box for video laryngoscopy. As I said, LMA isn't on here. You can always click other procedure if you want to record that you've done an LMA. Again, it asks your supervision level. And again, it's the same notes section that is completely optional. Again, I think if it's the first time you've done something and it's not something you do very often, for example, a fibre optic, the technique you've used for that specific fibre optic, you might want to make some notes so that you've got a reference point for future. You can click to add more than one type of procedure. So if you've done a laparotomy and they've ended up the central line and art line, a thoracic epidural, you can use this to continue adding. Epidural top-ups come as procedures. They don't come as regional, just FYI. Then it asks you if there's a significant event. Now, there is no real definition of a significant event. This can be something significant to you, which will probably change as you go throughout your training. However, if a critical incident happens, so if the patient's gone to anaphylaxis, if you've had a cardiac arrest, even if it's something as minor as a bit of laryngospasm, you might say yes and just explain in the notes at the bottom exactly what happened. And that's just a bit of a reference for you, again, in future. Again, in terms of the notes, it's completely optional what you put into here. I normally do write a little bit. I tend to say the age, the operation, and then if anything's happened untoward during that procedure. Let's just make sure I have actually filled all of these boxes in, otherwise it won't be happy. So then once you're happy that you have completed the case, you click Save Log. Now, often there is something you've missed and it will tell you and highlight the boxes in red if you've missed something. So that is a case added. Just so you can see some of the other ones, we'll also add a session. So a session, as I said, it says at the top things that are specifically good to use this for. So acute pain, chronic pain and intensive care can be covered in this section. And it is also good for things like lots of pre-op assessments that you might do when you're on call, or a little epoch or recovery ward round on your nights. So again, it'll tell you how many sessions you've done. It'll ask you your day. Generally, you're doing a session for a whole day or a morning, so you can click more than one box here. Again, it'll ask you where you did it, which, as I mentioned before, should auto-populate based on your current placement. And then it'll ask you specifically what it was for. So you've got some clinical pain round, you might have some notes review, some letter writing, intensive care, MDT meeting, so all the patients that you've discussed. You could use this as a record for things like M&M meetings, specific clinics, pre-op assessment, so that's if you've seen a bunch of patients in the morning and you just want to record them. Post-operative care, so often we do post-op reviews in obstetrics, so you might record all of the post-op reviews you've done there. If you're supervising lots of people, you might say the cases that you've supervised for, and then you can also cover theatre sessions in here if you'd like. Again, you talk about supervision. So we'll say that we've done some pre-op assessments and the supervision was local and it was a consultant. And then here you free text the patients that you might have seen. So you might say 23rd-year-old female, lap appendix, nil issues. You might say 72-year-old man for a laparotomy, needed blood cross-matching. And again, you can put as much detail as you like in here. Once you're happy, click Save Log. Now, to see logbook cases that you've got previously, you use Review Logbook under the Logbook tab, and it gives you quite a big page. So at the top is the filter section. We're going to come back to that in a second. Underneath this, you've got logbook entries, and here you can create summary reports, which we will also come back to in a little while. And then at the bottom, you've got your actual cases. So as you can see, if you hadn't, this personal reference was that optional box at the top. If you'd left that blank, all of these cases would have looked the same, and quite quickly they start to blur because they all come up as case anaesthetic or session. So they'll tell you what type of case it is. So that refers to the tab that you clicked at the start, so anaesthetic, ICU, session, the date of the case and the ID. The ID generated is just the order that you've added them to the LLP, so it's got nothing to do with the chronological order of when they are. Supervision is obviously your supervision level that you've called it, and this is where the personal reference can come in really handy because you can quickly see what this case refers to. And that's why I find adding the hospital, the type of shift, and just the specialty really helpful. If you want to see specific details, you just click on the case and it will show you the exact form that you filled in previously with all of the information that you clicked. So if you want to go back, you just click Return to Review. So we'll just go back to how to generate a summary report. So a summary report can be really useful in your ARCP or for getting specific domains signed off, because it tells people kind of what level of supervision you're at and how many cases that you're doing. So you'll have here, you've had 3 cases that are immediate supervision, but 4 cases that are local supervision. And obviously, as you move through your training from CT1 all the way up, you're aiming to get from cases being less immediate supervision to obviously more distant supervision. And you can obviously see how many cases you've been involved in teaching other people. And this can be used to generate a summary report. So if you click Summary Report at the moment, it will, at the moment, because we've got no filters applied, it will generate a summary report of everything that is on here. So we've got all 7 cases, various information about your logbook. So it'll tell you how many cases you've had involved in specific specialties, whether or not you've had direct or indirect supervision, and whether or not you've been providing any teaching. And it'll also generate a report based on the age of the patient. These boxes here refer to the specialty that you've picked them as. Secondary specialty is obviously if they've been a secondary specialty. And it will tell you what time of day most of your shifts have been, and specifically the type of supervision and the type of case that it's been, and it will generate patterns based on your working pattern, based on your teaching, based on the types of anaesthesia or procedures that you have provided. And then at the bottom, you can download this as a summary, which will transfer it to a PDF. Now, some supervisors will need this. So if you're getting your OBS signed off, for example, they like to see the proportion of spinal anaesthetics you've done, proportion of epidurals that you will have done, proportion of general anaesthetics that you will have done. However, your supervisor will not be interested in any other case that you've done outside of obstetrics because it's obviously not relevant. Let's just get back to the LLP there. So from here, just click back. So to make this relevant to the person that you're specifically sending it to, you use the filter section. So let's say that we are sending this to our PEDS lead to get our stage 1 PEDS module signed off. So you'd pop a filter in. And you'd say log type. So we specifically want anaesthetics, and also primary specialty is paediatrics. And you can leave this blank as all and do search notes PEDS. And this search notes box will search the name of that specific reference that you filled in, or alternatively, you can search specifically based on specialty and click paediatrics and filter logbook. So it will then tell you in your summary report that you've got 2 PEDS cases. And when you now click generate summary report, it will be a lot shorter. Obviously, in practice, you'll have hundreds of cases on your LLP by the end of your CT1 year and thousands by the end of your stage. And the generating a summary can actually take a good 5, 10, 15 minutes if you're trying to do the full logbook. Obviously, we've only got a couple of cases on here and they were all immediate supervision. But if you're getting to the point that you're needing to be signed off, for example, for your stage 1 PEDS, you'd send this report across to the trainer along with a filtered copy of the logbook so they can look at specific details to the cases, and they'd use that as evidence to decide whether or not you're ready to be signed off. So I'll just show you how to generate a filter of specific cases. So this is obviously the summary report. You'd click your download summary report as PDF. But to actually get more detailed report, so an actual filtered logbook, if you click return to review logbook, this top button here in purple will download your logbook, but it will download your logbook based on whatever filters you've currently got applied. So at the moment, we've still got our paediatric. Oh no, we don't. It's gone back. So let's, I'll show you at the moment how to download the whole logbook. So if you click download, again, it can take a little while to generate the export depending on how big your logbook is. We've got quite a small logbook at the moment, so it'll generate. You click download logbook again, and it downloads it as an Excel spreadsheet. So here it's got a lot more detail than the summary report. So it'll have everything that you filled in. So it's got your personal reference, it's got the specific age of the patient, their ASA, whether or not they were a day case, obviously priority and the specialty information, the exact operation that they had, teaching you provided, the type of anaesthesia that has been involved, the procedure that you've done, whether or not you were supervised, and it will also at the end have your specific notes that you've talked about for that specific case. The notes can become relevant and needed if you're needing to get a domain signed off that perhaps are cases that you might not see as often. So for example, stage 3 PEDS, I think you need to have had involvement in neonatal cases, but obviously you probably won't have seen that many. So for the neonates, you might want a bit more information. Or for your trauma modules, obviously each trauma is going to be slightly different, and you want to show a variety amongst that. So the notes section would show that you've seen different types of traumas. On this spreadsheet, you can obviously edit the spreadsheet as you would with anything, and before you send it to the supervisor, you can get rid of the bits of information like the school and the case ID, for example, the stuff that isn't going to really be relevant for them needing your sign off. All of these blank boxes you could obviously just delete and get rid of, and you can then save that and send it. So if we just close that for now, as I mentioned before, this download button will download a logbook based on whatever filters you've got in place. So if we pop another filter back in place for paediatrics, and it tells you download is now limited to your search filters. So we've now only got 2 cases, so this should hopefully not take any time at all. It's obviously a much smaller logbook this time. And we can click and open it, and that's your filters. So this is the way generally most consultants or supervisors will ask if they're domain leads to get things signed off for certain domains. And I think that's pretty much everything that I need to talk to you about the logbook. So just as a quick summary, just to go over all of that, if we go back to the first page, everything you need relating to your logbook is in this logbook tab. You can use specific tabs for the type of cases. Generally, we'll only really be using anaesthetic or session, and session is useful when you've seen lots of patients for similar things that you don't want to sit and complete quite a lengthy form for. You can just do quick freehand notes. If you want to see your logbook, you can click Review Logbook, and at the bottom you've got all of the cases that you've been involved in. If you want to see a bit more detail about a specific case, you can click the specific case like so, and that is where you see all the information about the case. Part of the Review Logbook page, we've talked about how to filter, and that can either then be used as that filter to create a specific summary report, which is just a quick glance, or to download a logbook, which will give all more details about your specific logbook. And I think that is everything. We've obviously talked about how to add cases, we've talked about keeping it organised, and we've talked about producing logbook summaries. In terms of keeping it organised, it's only going to be as organised as your own system, and you will develop your own system. But I really cannot emphasise enough how much easier it can be to filter and look for cases if you fill in that optional title box as something that is a little bit relevant. Feedback, you can use this barcode to give us any feedback. It's really helpful for us making future changes to the videos. Thank you for watching and listening.